In this short video, I want to take a little bit of time to go back to or remind you about the tension that exists for many supervisors between administrative supervision and reflective supervision. I want to also say that, of course, there are other things that come into supervision. Sometimes it's more didactic or there's teaching that happens within supervision, but for the purposes of this video, I really just want to talk about that tension between administrative tasks and clinical supervision tasks, because that is an ongoing, I think, challenge for people, especially as they're thinking about their supervision practice and learning about reflective supervision. So this is a learning from our past cohorts to really think about better ways or different ways to support you as you shift your practice, because it's just a challenge to manage that. One of the things that always comes up is really defining your role as both an administrative supervisor and a clinical supervisor. For most of you, you hold both of those roles. It might be that you're in your role as a supervisor, you're in your administrative role, you're evaluating their ability to get their paperwork in time, their productivity, or other sort of more administrative tasks. So I think it's really important to be really clear with your supervisees about the differences between those two tasks and the purposes of those two tasks with your supervisees. I also want to encourage you to think outside the box, because it could be that some administrative tasks that come up because a change of policy has occurred, or it could be that you're getting a message from your boss, your supervisor, that 3 of your team members are behind in their paperwork or productivity is low. Is that actually an opportunity that you might address that on a team level? Are there opportunities to address administrative issues on a site level or a program level? Might it be an email? Might you use an email with a survey monkey? Who knows? Be creative. But don't let administrative issues and tasks overtake the clinical supervision that is so important for your staff to be able to provide the best care to children and families that are being served. One other way to really attend to this difference is to make a plan about your structure of your supervision and to be really intentional and transparent about that. Sometimes, as I've already mentioned, there is a lot of pressure to address, I'll use an example, productivity. And so you may have somebody that you're working with and you've worked with for multiple weeks and doesn't seem to be changing, and you feel a lot of that stress to do that. I want to encourage you to not ever wholly drop clinical supervision from your time together. My sense is that if it's that urgent, it may be that you need to add some more meeting time if possible with that supervisee. But the supervisee, going back to the 3 core principles of reflective supervision, reflection, collaboration, and regularity, that's such an important piece of providing good supervision to your staff, whatever their role might be, that they can count on being able to discuss a child, a family, a situation with you, even if there are these other issues or pressures being communicated. I want to encourage you to think about how reflective supervision and your learning about reflective supervision or practicing reflective supervision may actually enhance your ability to address administrative issues. I have found that many people get shy about it because they're shifting. The sort of quality of their time together may feel different, may feel warmer. Reflective supervision is not just about being warm and fuzzy. It's still, we have to be able to address these, but it is possible that as you learn about reflective supervision and practice reflective supervision, that you actually may be able to address these things in a different way that may even be more effective. And that we should feel comfortable to address administrative tasks within the context of reflective supervision. It's not an either or. And I already said the word enhance. I do think that when you practice reflective supervision really well, it actually enhances your capacity to address administrative tasks. Thanks.